President Trump plans to lower drug prices, but is it the right prescription for the country? Arizona's bioscience industry weighs in. Plus, did you know your hospital gets graded? We look at hospital safety grades and what you need to know before your next visit. Plus, Arizona throws away about $9.5 billion in food each year. Find out how one organization is trying to change that. It's all that and more this evening on Broomhead. Welcome, I'm Mike Broomhead. Before we jump into today's interviews, let's take a look at one of the top stories.
Tit-for-tat tariffs and tough talk. The U.S. and China are temporarily calling a truce.
The talks in Geneva were very friendly.
President Donald Trump confirms over the weekend in Geneva, Switzerland, top U.S. and Chinese negotiators agreed to drastically reduce sky-high tariffs. The U.S. will bring tariffs on Chinese goods down from 145% to 30%. And China will lower tariffs on U.S. goods from 125% to 10%.
We're not looking to hurt China.
China calls the agreement a win-win.
This is like a sumo match. What you've seen is a lot of foot stomping.
Bill Reinsch, the former president of the National Foreign Trade Council, says a deal was inevitable.
Both sides have a lot at stake. Both sides have an interest in getting beyond this.
The agreement, however, lasts just 90 days. President Trump says both sides must work toward more fair trade conditions that allow U.S. businesses to sell more goods in China.
Because if you think about it, we opened up our country to China, and they didn't open their country to us. Never made sense to me. It's not fair.
Reinsch has doubts the U.S. can leverage much access.
It's a good goal, and I think Trump is right to focus on it. But so did Biden, so did Obama, so did both Bushes, so did Clinton.
If a deal does not arise in 90 days, President Trump says expect tariffs to go back up, but not as high as 145%. In Washington, Raquel Martin.
We have got, looks like a deal with China on tariffs, but the big news on this from President Trump is he said it's going to open up China. It's what he said he's most excited about. That decades ago, we opened our country to Chinese goods, and they have been making billions of dollars in America with their goods. Now he is saying that this deal, when it's finally signed, is going to open up China to American exports, which is going to do great things for American companies and allow us on more equal footing to sell our goods to the Chinese consumer. The two biggest economies on the planet working together, and a free exchange of goods is going to be good for us. Coming up, President Trump's latest executive order aims to lower drug prices. But is it sustainable, and how will it impact Arizona's bioscience industry? AZ Bio gives us their insight when Broomhead returns. It's important to recognize and thank the fine Arizona men and women who are serving in our country's military. One of the ways we like to do that is through a segment called From Arizona for America, and it's brought to you by my good friends at Sanderson Ford. So join me in honoring Marine Corps Sergeant Ryan Ulibarri, a native of Chandler, Arizona. He's a combat videographer with the Marine Corps Combat Service Support Schools, stationed at Camp Gilbert H. Johnson in North Carolina. For a list of more of our friends and neighbors that are from Arizona for America, just go to the Broomhead tab at cw7az.com. Big news, President Trump with an executive order that he says is going to lower health care costs for Americans. But to talk about that is the head of the AZ Bio Board of Directors, correct? And her name is Joan Kerber-Walker. Thanks for doing this.
Oh, it's my pleasure. You know, this is a very important topic, and it's one that your listeners and your viewers care about.
Yeah, and when we first heard it, it made a lot of sense to me that we need to do something to lower health care costs if we can, especially on prescription drugs for Americans. But I want to get a different perspective. What are your big concerns about this as it is written or as you've seen it written?
So the president made an announcement on Monday, the 12th, that we would institute as a country most favored nations pricing. Mm-hmm. And that what that means is that for every drug, they're going to look at large countries outside of the United States, look at what the best price is that they get, and that's the price that we will have as a nation. And that makes perfect sense when you hear it, right?
Right.
But there are some other factors that weigh in that are going to make it very challenging for his administration to implement that within the 30-day timeline that the president has requested.
So is it the timeline piece of it, or is the plan yourself? Do you believe the plan itself may be flawed?
So both have challenges, and we can kind of talk through those challenges. So when we talk about access, and just to step back, so AZBio, or the Arizona Bioindustry Association, which is a mouthful, so we say AZBio, is an organization of over 300 companies, organizations, and institutes in Arizona that employ over 365,000 people. And those Arizonans are all working to make life better for patients. That means patients have access to the medicine that they need, and equally important, that it doesn't burden them financially in the process.
Right.
And so we want to lower the drug costs in the United States. But today, the United States does subsidize research and development for the rest of the world. And that having our president step up on that is great. Implementing is important. Now, I know that you love our veterans.
I do.
And they know that it's not just the plan that's important, it's how you implement and execute on the plan. And so what we have to look at is, in the 30-day timeline that the president has set forth, how can they do that in a very complex U.S. healthcare model that isn't structured like those other countries?
But do you agree in principle that when the president says we want research and development, we encourage it, but America shouldn't be solely subsidizing it? Do you agree with that principle?
Absolutely. Because when we look at the world, most of the developed world has a single payer system. And that means that you have one monopoly to negotiate with. Mm-hmm. Monopolies abuse their power. And we have seen other countries do just that. Mm-hmm. And what they'll say is, if you don't meet my price, we won't put your drug in our country. That means if we have a new cancer drug that we have worked decades to bring to market to save lives, the companies have a choice. You can save lives and eat it, or you can walk away. Now, sometimes they walk away. So Canada is a great example. So here in the United States, we have many more new medicines available to us than are available to them. And exclusively in the United States, 82 medicines compared to their 41. So 50% more life-changing medicines. Do we want to go on the Canadian system?
Right. Do you think, very quickly, do you believe that this will be sorted out? That the 30-day timeline may be flexible, and do you believe that in one way or another this will be sorted out and we will get on a pathway?
I want to preface this with, I have not had a conversation with the president on this. But what we have seen with the president is he uses big announcements to negotiate. And he's done a pretty good job of doing some negotiating. And so I would hope that this becomes more of a trade discussion where his trade negotiators are going to these countries and saying, the rules are going to change, and we want you to start picking up more of your fair share. Now, he also in that EO talks about the supply chain, and specifically the pharmacy benefit managers. And the pharmacy benefit managers and other different pieces of the supply chain are actually about 50% of the healthcare dollar.
Well, I appreciate the time and the information. I think this is something the American people are obviously very focused on. This is a very complex situation. Hopefully we'll have another conversation about this in the future. We'll be back. Coming up, summertime is synonymous with sunshine and relaxing. But did you know it also is the time when hospitals see a surge in patient visits? We're taking a look at hospital safety grades and what you need to know about hospitals in the Phoenix area. That's next on Broomhead. Welcome back. Here is a great question. How safe is the hospital in your neighborhood? How safe is the hospital that you go to? Joining us now is Alice Campione. She's program analyst for the Leapfrog Group. First of all, thank you for doing this.
Absolutely. Happy to be here.
Yeah, I never really considered this. How safe is the hospital? What is a safety grade for a hospital? What goes into it, and why is it so important?
Sure, yes. So we know about 1 in 4 patients will experience an avoidable harm when they're in the hospital, and the consequences can be very serious. At least 250,000 people will die in the US each year due to these preventable errors, injuries, accidents, infections in the hospital setting. So about 20 years ago, not much was being done about this. There was no focus on patient safety, and that's how our safety grades were born. So now we grade just about every hospital across the country twice per year on their record for patient safety.
So what goes into that grade? Like, what's the criteria of what you're looking at?
Sure, yes, we look at a lot of things. Some of the measures are focused on process and structural things that a hospital can be doing. So like the infrastructure, whether they are using technology that prevents an error due to medication administration. And then the other measures are based on outcomes. So are they preventing infections? Are they preventing harm to patients during surgery and after surgery? So those two components go together to create the safety grade.
So patients, what should they be looking at in these safety grades? How does a patient interpret those grades?
Yes, yeah. So the chances of you experiencing harm is not the same at every hospital. Some hospitals do a better job than others at ensuring there are checks in place to prevent those mistakes, ensuring there's strong lines of communication between hospital staff, patients, and their families. And hospitals can strive to have teams that work well together and are properly trained. So what our safety grades do is give you the opportunity to do your research before you go to the hospital and determine what your local hospital is doing to prevent those medical errors.
So when you do these assessments, do you give the feedback to the hospitals? Is there a relationship with the hospitals where they're looking at your assessment and making changes, or is it not a working relationship?
Absolutely. So we actually provide a voluntary survey to hospitals. It's annual, and we assist hospitals in completing the survey. It's completely free to them. It's just their opportunity to be transparent and share what they're doing in the hospital setting. So we do work hand in hand with hospitals to help them improve and to reach these standards that were developed by experts at our organization.
Do you use patient feedback at all in any of the surveys?
Absolutely. So patient experience is a very powerful driver in preventing these preventable errors. 5 measures included in our survey actually look at patient experience. So patients and their families are often the first people to realize that something's wrong. So it's really important that they feel heard and that they have that direct connection to nurses and doctors.
I like what you said earlier about, they should kind of know what's going on ahead of time. You don't want to be in the middle of a health crisis and trying to do an assessment. So if someone's out there watching now, where do they go to get these safety grades, and how do they know they're reliable?
Yes, so you can go to hospitalsafetygrades.org, search for your city, and you can actually have an interactive map that can look at all the hospitals in your area. We can't guarantee that a hospital is perfectly safe, of course, but it means that they have a better track record reducing infections and preventing this unnecessary harm to their patients.
What is the response rate and the participation rate for hospitals when you reach out to them with the survey? What is the participation rate?
Yeah, so it's quite high. Actually, 3 in 4 hospitals, if not more, complete our survey annually. And this data it doesn't make up the entire grade. It's just a portion of it, but it really provides patients with insight into what hospitals are doing to prevent those errors from happening. So not just their track record, but what they're doing beforehand.
I really appreciate this information. I think it's going to open a lot of people's eyes, and it's probably going to help a lot of people make good choices. So thank you so much.
Absolutely. Thank you for having me.
We'll be right back. Coming up, around 119 billion pounds of food is thrown away every year in Arizona. One organization in the valley is finding innovative solutions to stop the waste and feed those in need. Learn all about them next. Here's a look at some upcoming events that should be on your radar. First up, Tom Jones is coming to the Valley tomorrow night starting at 7:30 p.m. at the Arizona Financial Theater. Tickets are available through Live Nation. Then it's the Phoenix Mercury versus the Los Angeles Sparks happening on May 21st starting at 7 p.m. at the Phoenix Arena. Tickets are available through Ticketmaster. We talk about hunger all the time and different ways to address it, and there is a great, unique way that we are addressing hunger right here in our community. I'm with Tonya, and she is with Waste Not, this great program. Tell us about the program.
Waste Not is a nonprofit organization that partners with restaurants, businesses to take their food that they're unable to use and get it into the hands of nonprofit organizations that are feeding hungry people in our community.
I was reading statistics. 1 in 10 are food insecure. Is that right?
Yes, yes.
That's amazing in this community where it seems like we're so prosperous to have that many hungry people and food insecure, and this is really helping address that.
Right, yeah. People, there are a lot of different variables that feed into that food insecurity. It could be, an income situation. Sometimes it's just having that access to be able to get to, a grocery store where they can get the food. So we just love the support of our partners who are finding all those places in the community and really helping to bridge the gap.
And I think people need to understand that we associate so often hunger with people that are unhoused.
Right.
But many of these people are working people who are just having a difficult time making ends meet, correct?
Correct. Yeah. So a lot of times, it's the decision of, am I taking care of my light bills or am I going to feed my family for the evening? And so, we're happy to be able to help make less of those, tough decisions by being able to, support those nonprofits that are able to provide the food boxes or able to serve a community meal.
And what's great about this is it's the perishable food items, correct?
Yes.
And you get donations from grocery stores and businesses. How does it work? So you get a notification or they call you that they've got food to be picked up.
Right.
Your drivers go and get it, and then what happens?
Right. So our drivers are on the road 5 days a week. They're visiting, grocery stores, sometimes even special events, are contacting us, and they're giving us all that food that they're unable to use. Same day, those drivers are going out, they're visiting, nonprofit agencies and delivering the food to them so they can put it together either, for use in a community pantry or for a daily meal.
And so many times this food gets right off the truck into a kitchen and it's dinner that night.
Correct. Yep, that's what's happening.
So if there are companies out there, whether they're caterers, whoever it might be, if they're interested in inquiring, how easy is it for them to get involved?
It's simple. All they have to do is make contact with our food sourcing specialist, James. They can find his information on our website, wastenoteaz.org, and just figure out, what they need to do to get in process.
So what about someone else? If an average citizen says, I'd like to support a cause like this, how do they get involved? Donations?
Yeah. So also on our website, Waste Not AZ, we have a giant donate button, so you can make donations there, or also get involved as a volunteer as well. So there's no shortage of ways that we can support this effort because the need is growing, and there are so many different ways that we can make those connections and really help bridge the gap.
And let's talk about the advantages, because for a business, you are a nonprofit, so this is a tax-deductible donation.
Yes.
You're not wasting the food anymore.
Right.
It's going to a great cause. You can take a tax deduction.
Exactly.
And it's helping this program feed hungry people. What could be better than this?
Right. Yeah, it's a great thing. Yeah, some of our business partners who've been around for a long time, they really see the value, that it's a cost savings to them actually to be able to, connect with us and have us take that, food that they're unable to use and be able to put it to good use in the community.
Round numbers, how many people do you feed a year or a month or a week? What do those numbers look like?
Yeah, so last year we were able to serve over 2.7 million meals with all the food, yes, that we claimed from businesses. So that's huge. And, as you mentioned, the need it's big here in our state. So we're very proud to be able to do that. And just with the support of more, community partners, we'll be able to continue to help really make an impact in that arena.
Well, Tonya, I thank you so much for your hard work. It's such a fantastic program, and thanks for everything you guys do.
Thank you.
Waste Not is the program. If you're a business that can donate some of the food that you have, if you're an individual that wants to support a worthwhile cause, feeding hungry people in our community, no one should be hungry right here where we live, and you can help stop that by joining Waste Not. Thanks for watching. Thank you to all the guests who joined us on today's show. Every Sunday here on Broomhead, we ask a new poll question we'd like you to participate in. This week, the question is, are you concerned about high prescription drug prices? All you have to do is head over to cw7az.com/Broomhead to respond to the poll question. Thank you for joining us this week on Broomhead.